Thanks for staying with us. Well, we are talking breast cancer awareness all month long. And today we have Dr. Emily Marcinkowski with UK Markey. She's a surgical oncologist with the Cancer Center there. Through the collaborative efforts with UK Markey Cancer Center Affiliate Network, Georgetown Cancer Center and Clark Regional Medical Center are able to offer patients the newest treatment options and emerging technologies. So important when somebody is facing such a mountain that they are given in a diagnosis. Thank you so much for being here with us today.
Thank you for having me.
Well, let's just talk about you and what you do to begin with. You're an oncologist.
Yes.
But specialized.
Yeah, so I'm a surgical oncologist, so I'm a board-certified general surgeon, board-certified in complex surgical oncology, so mainly taking care of breast cancers.
So you know a lot about this. That goes without saying. When a woman's diagnosed with breast cancer, it can probably feel like the entire world is caving in on you, and there's the options you don't know because people aren't out there researching options until it happens to them.
Correct.
And a lot of times it does involve surgery.
Yes, almost all breast cancers are treated with some form of surgery.
So what are the different options when it comes to surgical procedures?
So two major options. With breast cancer, you can either keep your breast, that's called breast conservation therapy. That's whenever we perform a lumpectomy, just removing the area of cancer, and that's then followed by radiation. The other option is with a mastectomy. So mastectomy means to remove the entirety of the breast.
So why would we do one or the other, and what is the best option in certain situations?
So that's the beauty of breast cancer. There's not really a best option. There's a best option for the patient. Most patients are a candidate for one or the other. Sometimes the tumor is large and the patient can't really have breast conservation therapy because it would distort their breast. So it's really, there's not a best option. It's really more for what the patient wants.
Sure. So I'm sure that has a collaboration with you as a doctor and your patient for what the best option is in that situation. A lot of times with mastectomies, people are just sometimes getting them done with their genetic results. Is that something people think, you know, I have breast cancer, let's just get rid of them completely?
Absolutely.
To prevent it from coming back?
Absolutely, and it's sort of a misconception. So about 5 to 10% of breast cancers are actually hereditary, and the remainder are just random. So reasons to do, you know, both sides, remove both breasts, or one, if they have a genetic mutation, so the BRCA1 or 2 gene, the breast cancer gene. Other reasons, some patients do it for symmetry's sake, so they want to look symmetrical, and some patients do it because they never, ever want to ever think about ever having another mammogram.
Deal with it again.
Right, but the actual risk to the contralateral, meaning opposite breast, is on the order of 0.2 to 0.4% per year, so it's very low.
Wow, so it is a lot smaller than we think.
It is a lot smaller than we think.
That's why it's so important to talk to somebody with you that actually knows these numbers.
Right.
And you also have an affiliation of other hospitals here in the area that are helping you out as well. Can you talk about that?
Absolutely. So the Markey Affiliate Network is a wide network. Two of the places that we work with are with Georgetown and with in Winchester. So I think it's great for patients that they can come and have the expertise that an NCI designated cancer center offers, but still get their chemotherapy close to home. Work with the doctors that they're comfortable with and that they're used to.
Sure. And what kind of benefit is that other than just the feeling at home? Is it to have a team like that diagnosing you and helping you get better? That has to be such a better, great experience for the patient to know that so many experts are on their side.
Exactly. For every patient that we see at Markey, we have a tumor board, right? And that's where all of the experts in the room are there. You have a radiation oncologist, medical oncologist, pathologist, diagnostic radiology, I mean, all the way down to one of our nurses who helps run the clinical trials. So having all those experts in the room talking about one patient at one time is very powerful. And I think that, you know, patients that come to see us, they have that benefit. They also have access to clinical trials that they might not have benefit or might not have access to at home.
Sure, the benefits are pretty much endless when it comes to that. If you had one piece of advice for all the women out there sitting here watching this, especially in, you know, Breast Cancer Awareness Month, what would you give us? What is your biggest piece of advice to help prevent it or to deal with it, anything?
Know your breasts. So you will know your breast more than I will ever know your breast, and that is so important to, you know, get your mammograms. Mammograms should be started at age 40, and then to know your breast, do your monthly breast exams, and know your body because you know it better than we will.
And a lot of times if we don't go to the doctor, we can figure out kind of online how to do these exams. But is it better to actually go into a doctor and have them show you and tell you what to look out for?
I think yes. There's really no trial that proves that, but I would say that from my experience, yes.
Don't be squeamish, right?
Don't be squeamish.
Don't be squeamish. We all have them.
I know.
Thank you so much for being here. What you do is so, so important.
Thank
How do
you.
we get a hold of you if we wanted to schedule an appointment or need any additional help?
So there's a Markey Cancer Center line. We also have a direct line to the breast center. And so we're happy to see anyone, happy to help.
And schedule those mammograms.
Schedule those mammograms.
Thank you so much for
You're
being
very
here
welcome.
and for all you do. Stay with us. We'll be right back.